So we are live, and I'll go ahead and introduce the session. We are at the New Mexico Poison and Drug Information Center, and today we're doing a live stream Q&A on pet poisoning and pet exposure. We have some questions to go over ahead of time, and we also will be accepting questions over chat. So anyone participating in chat, anyone watching this, feel free to build over your questions. I'll make sure they get handed over to our specialists here. Now, I'll go ahead and hand over self-introductions to our NMPDIC members, as well as Dr. Wismer. So first, we'll go ahead and start with our director.
Hi, I'm Dr. Susan Smolinski. I'm the director of the New Mexico Poison Center. I've been here 8 years, but I've worked at 4 different poison centers for a total of 40+ years. So I've handled a lot of animal poisonings.
And I'm Jack Capus. I'm the health education coordinator here for almost 13 years now. And I've been an educator for the 13 years.
I'm LaDonna Bonin. I'm the associate director. I'm also a pharmacist and worked on the phones as a certified specialist in poison information for almost 21 years.
I'm Dr. Tina Wismer. I am one of the senior directors here at the ASPCA Animal Poison Control Center, and I will have been here 25 years in July. So seems like we got a lot of experience here.
Okay, so let's go ahead and get started into the first questions here. So first, we'd like to ask NMPDIC, how many calls do you receive for pet poisoning?
Yeah, I'd be glad to answer that question. So last year, we received about 26,000 calls from the public, and about 5% of those were related to animal poisonings. But I will say it was overwhelmingly dogs versus cats. So 4.5% of our calls were related to the dogs who get into things. So maybe Dr. Wismer can tell us eventually why that is, that cats know better.
So just piggybacking off of that question, what is the role of NMPDIC in handling pet poisoning calls?
So I'll go ahead and answer that. So our pharmacists are not trained in animal toxicology. Now, we are animal lovers, and so we're happy to answer animal calls that we can find good information for. Unfortunately, we don't have like a ton of information, but we do have some references that we can use to handle some of the more common stuff. So chocolate, xylitol, and gums. Both of those are really great examples of things that we can help someone manage pretty well. We are able to do those calculations. We also can manage some medications because we have a pretty good reference for that. But in general, the information we have on animals is not good. And we're also not, like I said, we're not trained to treat an animal. And so in the end, the Animal Poison Control Center at ASPCA is still going to be the best reference. And many times we do end up referring our callers to them for a higher level of evaluation.
Awesome. Thank you. So this one, we'll actually go ahead and turn this one over to Dr. Wismer. So how many calls does the ASPCA Animal Poison Control Center receive each year?
We are pretty close to 400,000 calls about animals a year. So it's all we do here. We don't play with the people at all, just the animals.
Awesome, thank you for that. So we'll kind of start going into some of the more common medications that might be worrisome to our animals here. We will get insight into NMPDIC as well as the ASPCA insight into this question. But first we'll start with NMPDIC. what medications are more worrisome for dogs?
All right, I'll start with that. We have a small list. There's actually a bigger list of things we worry about in dogs. Our experience, and probably Dr. Wismer's experience, is when dogs get into medications, they often ingest the entire container, including the plastic it's in. So you do end up with larger amounts of exposure. Things we worry about in particular, isoniazid, which is a medication not used very much anymore for tuberculosis, but that is dangerous in people, but also especially in dogs who have seizures from it. And then we know there's certain medications that, even among people, we all have different ways we metabolize drugs. And that's especially different in the animal kingdom where, even different species metabolize things differently. So also on our list is sulfonamides. And these are antibiotic medications that we don't worry so much at all about in people, but affects tear glands in dogs. Estrogens like birth control pills, we don't worry about at all in people. We always keep those at home. And both cats and dogs can get bone marrow suppression from that, is our understanding. And then there's certain pain medications, acetaminophen, of course, we worry about it more in cats than in dogs, but certain non-steroidal medications like ibuprofen is a concern for dogs. And we do know there's some in that class that are prescribed by veterinarians to treat illnesses in dogs. And then the last thing we worry about is xylitol. And that is handled very differently in dogs than it is in people. So people take xylitol in, say, sugarless candy, sugarless gum. It's in hundreds of thousands of products. It's really in a lot of places. And people, if we ingest a lot of xylitol, we just get diarrhea. But when dogs, if they ingest a certain amount, it lowers their blood sugar, which can give them seizures, and a higher amount will actually harm their liver. So it's extremely dangerous in pets, and it is difficult to find the amount of xylitol on a particular labeled product. So that's one of the things, if we have some databases that we can use to identify the amount in a particular brand of gum, for example, and we can use that to help you decide whether that dog needs to go to the vet. But I know that ASPCA has a much larger database, a more complete database. If we can't find it, we're going to work there. So Dr. Wismer, if you can expand on that, tell me where I went wrong.
You didn't go wrong anywhere, right? All of those things certainly can be problematic. I do want to touch on over-the-counter medications. You mentioned pain meds. Because we all have these in our house, we don't think about these being, that serious. But probably one of the most dangerous drugs that we may have in our house is actually naproxen. Common name brand is Aleve. And the problem with this is that one pill in a 20-pound dog is enough to cause stomach ulcers and kidney failure. So, if an animal gets into this, you're looking at multiple days in the hospital. So that one is one that we like to avoid if possible. We also have to think about the rise of vitamin D, right? Physicians tell us we're all vitamin D deficient, right? We never go outside, and when we do, we wear sunscreen. So we take oral vitamin D. So the amounts in these capsules have gone up exponentially over the past 5 to 10 years. So animals can easily, eat a few tablets of vitamin D and end up once again having kidney failure. So certainly over-the-counter stuff can be bad.
Well, thank you for that insight. So I actually did want to go ahead and mention, there's not a question in chat yet, but Debbie Garcia said, good afternoon, everyone. So good
Hello.
afternoon
Hello,
to you
Debbie.
too.
Hello.
And so just kind of tuning along though, with these questions. Is there anything that you can do at home to remove these poisons if they are exposed?
Well, I'll let LaDonna start with this.
Sure.
because she,
So there are ways to decontaminate at home. Probably the most common would be to make an animal vomit, a dog specifically. We don't make cats vomit. The situation with that is that there are a number of instances in which you would not want to clear the stomach. That would be if something caustic was ingested. It would be if it's something that could cause excessive drowsiness, which could cause the animal to choke as it's vomiting and then get the vomit into their lungs. Also, if something causes seizures, that could be a concern as well. And so our specialists here at the Poison Center, we do not in general make recommendations for vomiting at home because there are a number of factors that can contribute to increased risk for toxicity. So if we make the initial, because we can make some initial evaluations of the situation, and if we feel like maybe this dog would benefit from vomiting, we may recommend them to their veterinarian, or we may recommend that they call the animal poison control line, where they can be more carefully followed so that emesis, if necessary, or vomiting is necessary, that it can be closely monitored, because we do not follow up on our animal calls, but that's the type of thing that would need to be closely monitored.
So
Dr. Wismer, do you want to add to that?
Sure. First of all, let's address cats, right? You know, my cats vomit all the time, but there's nothing safe to make them vomit with at home, right? We do joke about having that priceless oriental carpet to put under them, because then they would vomit. But they really do need to see the veterinarian to induce vomiting. For dogs, you're correct. There are sometimes we will make them vomit at home, but we're going to ask a lot of questions first. What did the animal get into? How much does the animal weigh? Does the animal have any health problems, right? Have they had any recent surgeries? These are all questions, and we have to take into an account what the answers are before we say, yes, it's safe to vomit at home, or sorry, you need to see the veterinarian.
Great. Dr. Wismer, do you consider the breed of dog when you induce vomiting, like the pug-nosed dogs, or are they a particular risk for vomiting?
That is a great question. Yes. Any dog that's brachiocephalic, right? The little short-nosed dogs, that little snorty farties is what we call them. People love them, but they do have a much higher risk of aspirating, right? Inhaling vomit into their lungs. So many times those get sent to the veterinarian.
And that is one of the reasons why, as I've mentioned numerous times, our pharmacists are not trained in animal toxicology. And while we may think to ask about the breed, and if you happen to know what that breed looks like even, it may send off a bell that this is something bad. But that is definitely one of the things why we don't handle that type of thing at our Poison Center, and why it's so important to get a veterinary professional involved.
awesome. So I actually did want to mention, just to chime in real quick, so we will be going until 1 p.m. Mountain Time. I don't believe I mentioned at the beginning of the stream. So anyone that's watching right now live, feel free to send in any questions you have over chat. We are live on YouTube and we are live on Facebook, so feel free to send in any questions. But continuing, this is for Dr. Wismer. So how long after exposure is vomiting effective?
That's a great question. And the answer is always, it depends, right? So if we're talking about something like cold medications or our pain medications, you really only have about 5 to 10 minutes to induce vomiting, right? Because think about it, you don't want to wait around for a couple of hours for your headache to go away, right? So those act really quickly. But other things stay in the stomach for a long period of time. Mouse and rat baits, we typically have 4 hours before they're absorbed. And chocolate can actually hang out in the stomach for up to about 12 hours post-exposure. So if they're not vomiting already, sometimes we will go ahead and induce several hours later.
Thank you for that. So I did want to go ahead and pass this along to our NMPDIC members here. Initially, and then we'll go to Dr. Wismer, but when should I take the pet to the veterinarian?
Right. Okay, yeah, sure, I'll take it. So I've spent a lot of time on the phone, so I've taken a lot of animal calls in my career. So there are certain things that right away we would, without even saying anything else to us, we will send the animal into the veterinarian. One, if they're having life-threatening symptoms, right? If they're having difficulties breathing, if they are having a seizure, if they are so drowsy that they're hard to wake, or they seem to be just really confused, not reacting, those are immediate referrals without really even getting any further history.
And cats, you often refer with many things.
Yeah, I mean, our information in cats is nowhere near as strong as in dogs, and even our information on dogs is not fantastic. And so cats just also tend to be, in my practice anyway, more sensitive to just about everything. So we do tend to send cats in to see a veterinarian much more frequently than dogs.
And Dr. Wismer, do you have any additional insight into this?
So you hit the big important points. We actually use the acronym BUDS, B-U-D-S. So bleeding, unconscious, difficulty breathing, seizures. If the animal's experiencing any of the BUDS, they go straight to the veterinarian. So you hit the high points. And to mention, right, you're talking about dogs, and it is mostly dogs. You said that most of your animal calls are dogs. Most of our animal calls are dogs too. It's almost 88% dogs. Literally, they explore their environment with their mouth, right? You know, we think of them almost as like toddlers on speed, right? They're everywhere and everything goes in the mouth. And they have that, we also say potato chip mentality, right? If one is good, more is better. They don't stop till they get to the bottom of the bag or the bottom of the box or the entire pan of brownies.
Awesome, thank you. So I know we talked about kind of medications earlier. I did want to go ahead and ask what foods that can be issues for our pets.
All right, I'll start with that one. We mentioned xylitol already, that's in foods as well as in candies and mints and gums. But things we worry about are grapes and raisins. And I know that ASPCA website has some good information on that, with how many grapes are toxic for a dog. They can cause kidney failure. We also worry about onions in both cats and dogs. And there's that can cause a type of anemia in these animals and bleeding issues. And of course, chocolate. And we do, you know, chocolate, dogs are very sensitive to chocolate and they love it. One Christmas I came home and I had gotten a Christmas present wrapped very prettily from a friend from Germany with a chocolate bar. And when I got home, both dogs had gotten into it and were going a little wild. But so it does matter what kind of chocolate. Dark chocolate being much more hazardous. It's the theobromine in chocolate that we worry about. And there's actually an online calculator that we can use to determine whether we need to refer that dog to the vet for a chocolate exposure. It doesn't list all the particular brands of chocolate, but it has many of them. And if you want to put that into the chat for people, that'd be great. Other things I've had experience with, macadamia nuts, particularly in dog. It's kind of weird. Dr. Wismer can expound on this. I don't know what the toxin is in the nuts, but dogs get very weak-limbed, inability to stand, and in 24 hours they're fine again. So, and one unfortunate issue I had with a food was a a big chested dog. It was a Great Dane who ate some raw bread dough. Raw bread dough has yeast in it. If it does have yeast in it, that's the issue. And in these animals, of course, they're horizontal, we're vertical. We could chomp on the cookie dough that our grandma's made for us with impunity, but dogs will eat a huge amount, as Dr. Wismer said, and this dog ate a huge amount of bread dough. It expands in the stomach, it produces alcohol, they get intoxicated, they lay down, they're horizontal, and it actually expanded and crushed this dog's heart and he died. So that's one I worry about. Another one I've published on is a type of ornamental gourd. So there's a Japanese pumpkin called a kombucha pumpkin. And we had a couple laboratory retrievers who were playing in a field, both decided to eat on this pumpkin and both developed seizures. And so we worked with a veterinarian and we published these case reports. And these contain an ingredient called coburdicins, which are also toxic in people, but people don't get seizures because we don't eat an entire pumpkin. And I did some follow-up on these dogs a year later, and they went back to the same patch and ate the same pumpkins. Obviously didn't learn from the experience. But so those are some unusual foods I've had experience with.
Pass this along to Dr. Wismer. Do you have any additional insight into this too?
Sure, you definitely hit the big ones. Chocolate actually makes up almost 13% of our phone calls here at Poison Control. That works out to almost 5 calls an hour just on chocolate, if you look at the entire year. But certainly it is clustered around the chocolate holidays, right? Halloween, Christmas, Valentine's, Easter. And dogs love it, right? I mean, cats, not so much. Cats don't have sweet taste buds, so they're not that attracted to things like chocolate. Usually they'll sample it, but they don't eat as much as dogs do. You mentioned grapes and raisins. We now know what the toxic component is in grapes and raisins, and it is tartaric acid. So tartaric acid is found in many fruits, but grapes and tamarind fruits have really high amounts of it compared to everything else, all the other fruits. And dogs are strange in the fact that they do not excrete these organic acids very well. So it actually accumulates in their kidneys and it causes damage to the cells that line the kidneys and can cause kidney failure. So it's just dogs. Cats don't have a problem. People don't have a problem, but definitely we want to keep away grapes and raisins. As you said, there is more information on our website, but basically anything more than 1 grape or raisin per 10 pounds of dog needs to be addressed.
Thank you. And we actually just got our first chat from Facebook from Debbie Garcia. Speaking of alcohol, what about animals ingesting alcoholic beverages?
I'll just Wismer.
Okay, so the dog's alcoholic beverage of choice is the White Russian because of the cream that's in there, right? It attracts them, but they can become intoxicated with any type of alcohol, just like people. And it is pretty close in the amounts that it takes per pound of person, right? So if you think about for a 100-pound person, 2 shots of alcohol makes it unable for you to drive. You know, if you've got a 10-pound dog, you know, 1/10 of that is enough to be a problem. Now, of course, they're not driving, but we can see the same signs, right? They get wobbly, they can vomit, they can inhale the vomit, and they can become comatose. Now, because we did just mention grapes and raisins, I do have to mention that wine is actually detartrated. So it means there's no tartaric acid left there. evidently it looks like ground glass and it precipitates out, and no one wants something that looks like ground glass in their wine. So for wine, we just worry about alcohol. We don't worry about the kidneys.
Thank you, and thank you, Debbie, for that question. So I do want to go ahead and ask, so how do I determine how much xylitol is in my gum or candy?
All right, I'll start with that. The first thing we do is have the caller look at the label of the particular gum. In foods, our FDA wants us to list the food in decreasing order, so the highest concentration ingredient is listed first. So if xylitol is the first ingredient listed, and the nutrition fact says sugar alcohol and gives an amount, say sugar alcohol 1 gram per piece of gum. And if xylitol is #1 ingredient, we assume there's 1 gram of xylitol. We can use that in our calculation. Let's say xylitol is the second ingredient. Say the first one is sorbitol, and then there's xylitol. Then we can make an assumption, again, that about 1/3 of that is xylitol. And we do, as I mentioned, we have some databases. There's a human poisoning database called Web Poison Control that you can download an app on your phone. It is totally designed for human poisonings. Do not use it to assess your poisoning in your animal. However, you can use it to look up what's in things. So if you go to that system and you type in xylitol as a substance, you will get a list of brand names of gums and candies and how much is in, and take that and then call the Animal Poison Center and say, what do we do with this amount of xylitol? And they can confirm with their database, which is much more extensive.
Awesome. And anything for Dr. Wismer? Anything to add to that?
Not really. I mean, you are correct. It has to do with the order. And when we deal with things like sugar-free gum, xylitol can be the first ingredient, or it could be like the 11th ingredient. So there can be a magnitude of difference on how much xylitol is in different brands of gum. And it can even vary in different flavors in the same brand of gum. So that's what makes it a little frustrating sometimes.
Thank you. So I actually wanted to go ahead and swap over to kind of a discussion on rodenticides and kind of their effect on exposure for our pets, kind of the issues there.
Well, there are a number, I can take
Yeah,
it
go ahead.
initially, yeah. So there are a number of different rodenticides that are available on the market. In the United States, the two that used to be most common are, was warfarin, which is an anticoagulant, and then the long-acting anticoagulants, which with some of the names you might see would be bromadiolone or budificum. And both of those cause the mice to die somewhere else. That was kind of how decon was marketed, right? Is that the mice would come and they would eat it and they'd go someplace else and die later on, not in your home. Well, it can also, if an animal gets into these anticoagulants, they can also cause bleeding, which can be delayed depending on the product. Now, more recently, there has been a trend to decrease the amount of anticoagulants and rodenticides in favor of a vitamin D type product, which goes back to what Dr. Wismer was talking about earlier with vitamin D toxicity in dogs. And so these can definitely be a problem for sure. One of the things that we many times recommend in dogs specifically with the rodenticides is almost always for them to speak with their veterinarian or the animal poison control line, because these are some that early on can be decontaminated with vomiting. And so that's what we do with that. There's also one more rodenticide out there, which is bromethylene, which is also not as common. Now that's one that we would never make someone vomit because it can potentially cause seizures. So that's one of the ones where we would send the dog to the veterinarian or to the Animal Poison Control Center right away.
I guess the other one you didn't mention were the zinc phosphide rodenticides.
For sure. Yeah.
Those are not very commonly used, but they're a particular concern for our animals that get into them. We would send them to the vet for vomiting to be induced there. And where we've been called is by the veterinary clinic saying, we made this dog vomit in the clinic and now my staff are feeling ill. What's going on? And what happens is that this produces phosphine gas once you swallow it and once it is interacting with the acid and water in your stomach. And then when you make the dog vomit, you aerosolize this. In the veterinary clinic, people inhale it and become ill. So we actually developed a protocol for that veterinarians now use when they vomit a dog in the office with this particular rodenticide. Take that animal outside, have some ventilation. So that's just a unique one we worry about.
And one thing I'd like to add real fast about zinc phosphide specifically is that, anyway, my practice will correct me if I'm wrong, not usually in the home for mice. Those are more commonly used for gophers and are usually something anyway in New Mexico that you get from your like county extension offices and stuff. So these are the things that dogs can be exposed to exploratorily, where they're hanging out in maybe a field or something where someone put it down for like a gopher or like prairie dogs. So it's always helpful when you call us, when you go to the vet, when you call Animal Poison Control Center, that there's a good history as to how the animal was exposed. Were they out in a rural area? Did they get in a package behind the refrigerator? Two kind of different things, and it helps us as well.
So now, Dr. Wismer, to get a little bit more insight into this too, I also wanted to go ahead and add, can a dog or cat or really any animal become sick from potentially eating an infected rat or poison mouse?
So, yeah, great questions here. So, the point about knowing what type of rodenticide it is, what type of rat bait, what type of mouse bait makes my job easier. It also is easier on your pocketbook, right? Because if we don't know what type it is, right? Sometimes people will say, well, it's the green kind or it's the blue kind. They're not color coded. So we treat anticoagulants, bromethylin, and the vitamin D baits differently. So if we don't know which one it is, we have to treat and protect against all three. Also, please, if your animal eats a rodenticide, address it immediately, right? Call your veterinarian, call the emergency clinic, call poison control, because many of these animals will look totally normal, even up to a week later with some of these, and then they can bleed to death internally, or, they can develop neurologic signs. So definitely, if you see it happen, don't wait, call right away. Your last question was about what we call relay toxicity, right? A pet eating a poisoned animal. And we get this call a lot, right? Oh my gosh, Fluffy ate a dead mouse. What do I do? So my first question always is, what is Fluffy, right? Is Fluffy a barn cat? Is Fluffy a raptor, right? In those cases, poisoned rodents are going to make up a large amount of their diet, and they definitely can have a problem. If Fluffy's a house dog or house cat that may get one poisoned rodent, it's not going to be a problem, okay? One of them is not enough, but main part of the diet, then we need to address the situation.
Thank you. And we actually have another question from chat. Thank you, Debbie. And with Easter around the corner, my concern is hard-boiled eggs. Is there any concern with eggs in general for both dogs and cats? And we'll go ahead and pass this along to Dr. Wismer.
Other than the gas that they produce in the animals, they're really not a problem. The only thing we do worry is if you are hiding eggs outside, right? And your children miss gathering the eggs, if they do become rotten, they can potentially grow things like molds that can cause problems like tremors and seizures. But no, an egg is actually pretty darn safe and healthy for animals.
That's great to hear. And thank you, Debbie, for that question. So we'll kind of move along on this. And now my next question is, what insecticides are dangerous for pets? And we'll pass this along to NMPDIC first.
You can go first.
Well, fortunately, our insecticides have gotten a lot safer, but some of the things that we often hear about in pets, and this relates specifically to cats, is where a collar will use a flea product that's intended for a dog and they put it on a cat. Those products are formulated very differently. Cats are very sensitive to something called permethrin family, and they can develop seizures. So that's an issue. The other issue is now there's this trend for all these botanical insecticides. They're even called safer insecticides for people, and they have all these volatile oils in them. Some of them have an ingredient called linalool that is present in some citrus fruits naturally and is a component of these products. And cats, you should not use those around cats or on cats. Very sensitive to those. Pass it on to Dr. Wismer.
So you hit the major point, right? Read the label. If you follow label directions, these insecticides are quite safe. Okay. Dilute them correctly. Keep the animals away while the product is still wet. If you're using a product on the animal, make sure it's labeled for that species. And many times it'll say, like if you're using a flea spray, so many pumps per pound of animal, right? Follow those directions. And if you do, we should be golden, right? It's when we cut corners and don't read labels that our animals get into trouble. Oh, and put the product away afterwards, right? Don't leave the bag of insecticides sitting in the backyard for the dog to get into.
So bouncing off of that, how about dangerous plants? Are there specific plants that are just naturally dangerous to cats, dogs, pets in general?
Yeah, there are a number of kind of interesting plants that we don't worry at all when a toddler ingests that plant, but we do worry very much, particularly with cats are much more sensitive to plants than dogs are. And one thing that will be coming up in about a month is Easter and the Easter lily, basically anything in the lily family. I've heard it say colloquially that a cat can just pass by and whisper, touch it, and they'll develop kidney failure. That's probably not true, but a very small amount of a lily plant can be extremely hazardous to a cat.
And this is definitely one of the subjects that, as far as our hotline, our human poison control hotline, we do not have good information on. Now, what we use normally as our primary reference is the ASPCA's website, which has a great search engine for plants and a lot of great information on it. And that's our primary resource. So these are many times some of the calls that we will hand off to the Animal Poison Control Center.
So yeah, they don't just have to pass by, but coming into contact with the pollen, right, is enough to be a problem. And if you've ever had lilies, the pollen gets everywhere. So it's not uncommon that, cats will come in and they've got like the yellow pollen streaked all over their fur. And yes, it can cause kidney failure. And this is also a toxin that we don't let the sun set on, right? If we see an exposure, we take him to the veterinarian immediately. We have a nice window of about 18 hours post-exposure that if we start treatment for lilies, the cats do very well, right? They get IV fluids for typically 2 days. If we wait after that 18-hour time period, our prognosis goes down. Another plant that we think about being problematic are sago palms or cycad palms, or members of the Zamia family. And those can cause liver failure in dogs and cats. Where I live in Illinois, right, we don't have these planted outside, right? It's way too cold here. But I can go to my local hardware store and buy these cute little potted cycad palms, and they're not labeled as being potentially toxic to pets. So always know what you're buying beforehand, right? Look it up on the website, because ounce of prevention is definitely a lot cheaper than that pound of cure.
Thank you. So kind of shift a little bit more here, and now we'll kind of go to, are there any topical products that are dangerous to animals?
Okay, well, I'll start. So from the Poison Center perspective, one of the things that dogs seem to get into are the zinc oxide ointments. You have the Desitin ointment out, put on the baby, you leave the tube on the counter and the dog gets into it. And you can read some scary things about zinc and dogs, causing a lot of GI distress and vomiting and potentially some anemias, but it's my understanding that only happens with zinc in coins and other forms of zinc. The ointments are generally not that bad. A couple topicals that we do worry about, there are some topicals used for skin cancer, one called fluorouracil. This is a cream and it does not take very much to cause serious toxicity in an animal for that one. And then the other one we worry about is something used for psoriasis called Dovanex. And this is a vitamin D type containing cream, very highly concentrated and can be very dangerous in pets. Those are the ones that come to mind for me.
Yeah, I think the ones that I would maybe just add is and honestly, I'm not sure about this. And so I would love to hear what Dr. Wismer says. But the camphor containing like Vicks vapor rubs, the other like Bengay products that contain salicylates. I know that those are a problem in humans, but I would suspect that they are also an issue in small animals.
So with salicylate type ointments, right, those arthritis creams, they're so irritating to the stomach, like the zinc oxide ointment is, that animals decontaminate themselves, right? They vomit it back up. So fortunately, we don't see the severe problems that you can see with people with, heavy dermal use. Camphor, not so much of an issue, but phenols are a problem. So like camphorphenique, and it's a cat thing, right? Cats get severe anemia and oral burns with those. But yeah, things like Vicks Vapor Rub, they actually use in in some zoologic parks as enrichment for cats. They love to rub up against it and they love the smell of it. My mother was a big Vicks proponent, right? That's what we got growing up. And she would put it on her nose and literally the cats would come up and lick your nose and it's already red and irritated. So they were not having a problem poisoning with it, but I don't think it made me feel any better.
Thank you for that insight. So I actually wanted to go ahead and take some time to mention, we have about 15 minutes left on this live stream. Feel free to send in any more questions, anything that you want over the chat, and I'll field this to our specialists here. I did want to take some time to also mention the poison control hotline number is 1-800-222-1222. And the ASPCA Animal Poison Control Center hotline number is 1-888-426-4435. Now, continuing on. This is somewhat a more common or recent issue, or maybe ramping up to be a more recent issue with the current New Mexico laws regarding cannabis and how it's now legal and recreational. Is cannabis a problem for our pets, for our dogs, cats?
From my experience, definitely a problem in dogs.
Me too.
Cats seem to avoid it. And the issue has worsened over the year because our cannabis, first of all, the native plant has become more concentrated in the active ingredients. So takes less to cause intoxication. And we also have, a lot more, and especially in New Mexico where it's recreational use is legalized, but we have really attractive packaging. We have gummies, and I presume some of those gummies may contain xylitol and the other issues for the pets. They're in candy bars, so now we have to breathe out chocolate in addition to the cannabis. And then we have all these what are called minor cannabinoids. So you may have a product that's half and half CBD and THC, and you have these entourage products that may have 5 or 6 different cannabinoids, none of which have been studied in animals, let alone humans. So I think it's going to be a worsening problem for our pets, and it's definitely a product that you should not only keep out of reach from your children, but make sure that the animals cannot get into it. So.
Yes. So, 25 years ago when I started this, we used to always joke about, Pink Floyd and Doritos. That's how you treated the animals they got into it. But the exposures have changed. Now, cats will still get into some of the plant material, right? They'll get into the baggies or, into the joints, but they don't eat enough to be a serious problem. But dogs, right, because they have no off button, will eat the entire candy bar, which is typically, anywhere from, 8 to 12 doses worth. So if our animals are able to walk, if they're able to respond to their name, then they can stay home. But if the product contains, chocolate, or if it contains xylitol, then you should give your veterinarian a call. And certainly if they're comatose or they can't walk, then they need to see the veterinarian. It's pretty rare that we have deaths, but it can occur. The typical marijuana dog, most veterinarians can now diagnose them, seeing them across the room, right? They're a little wobbly, they're hyperesthetic, right? They overreact to sound and they dribble urine, right? They're urinary incontinent. So it's pretty easy to spot.
And so just continuing on from that, thank you for your insight into this. I do want to ask, what are some dangerous dietary supplements to look out for?
All right, well, again, I'll just speak with a couple groups that we seem to get calls on. One are these either single or multiple ingredient. Usually they're used for sleep or sedative or stress, that contain 5-hydroxytryptophan. And so this is a serotonin agonist, and the dogs develop serotonin toxicity. So there've been a number of case reports on that one. And then the other ones we worry about in both people and dogs, but dogs we know are very sensitive to caffeine. And there are these pre-workout products that are often flavored, they taste good, they're in powder form, and contain a huge amount of caffeine along with other stimulants often. And I think those would be an issue for a dog.
And we have limited information on dietary supplements in humans, extremely limited, much less in animals. So these are not ingestions that our specialists tend to handle at our poison center for that reason.
And some of the big problems with both your 5-hydroxytryptophan and caffeine is that they act so quickly in animals, right? And we see severe effects within, a couple of hours. So, if you're not home and this happens, unfortunately, you could potentially come home to a dead animal. So these are definitely things we need to keep away from our patients. On the veterinary side of these things, we also have some of our dietary supplements. And there's a strange thing that can happen when animals get into a bunch of like joint chews, right? Or calming chews. And if they are soft chews, it actually pulls water into the GI tract, right? So we see vomiting and diarrhea, but it also really affects their electrolytes. And we can see dogs having tremors and seizures because their blood sodium gets too high. So it's not necessarily the active ingredients in the supplement. It's the inactive ingredients, right? It's the stuff that keeps the soft chews soft.
Thank you. So, continuing on, I do like this question. I'm sure we've all experienced this at some point, sometimes multiple times with the same animal. But what is the best way to de-skunk a dog?
All right, well, I'll let LaDonna give our favorite poison center recipe.
I don't have it memorized.
You don't have it
No,
memorized?
no, I don't have it memorized. I think you have it written down.
Yeah, so you can mix with some household products, so a quart of peroxide. You can add a fourth of a cup of baking soda and a little bit of dish detergent and bathe the animal. I would suggest this for dogs and probably not cats. I would defer to a veterinarian for anything related to a cat. But it works very well for dogs. Something that's also been studied in the literature is something called Gojo hand cleaner. And this is a cleaner that contains a little bit of a petroleum product in it. So it's used in humans for kind of grimy, greasy hands to wash your hands with. It's got a little abrasive thing in it. And apparently that removes the skunk odor quite well in dogs, but I don't have any personal experience with it. Dr. Wismer?
Try to have as little personal experience with skunks as I can. But it is skunk breeding season here in Illinois. So a lot of skunk dogs in my area. I do like the recipe with the peroxide, the baking soda, and the dish detergent. So, wet down the animal with this, leave it for about 10 minutes, and then rinse it off. Because skunk spray is oil-based, we need something that's going to remove the oils from the coat. So that's why your liquid dish detergent works well, or the Gojo hand cleaner, right? They do also make products that you can buy at the pet store, like Skunk Off or some Nature's Miracle stuff that also works. But yeah, definitely use those type of products. One thing we do need to worry about, if your dog gets sprayed in the face, right, they can inhale the spray, and the captans are chemicals in the skunk spray. They can actually cause anemia in dogs here and change their blood so it can't carry oxygen. So definitely, if they get sprayed in the face, make sure they're breathing normally, right? Make sure their gum color is normal. Otherwise, they need to see the veterinarian immediately, even though they will not be happy with you coming in the door with that recently skunked dog.
Thank you. So continuing on, how do we handle envenomations in pets? Things like black widows, rattlesnakes, and things like that.
Well, we're definitely getting into that season, it's warming up anyway. Well, not really here, but eventually it will. And so our snake season is definitely getting underway. Now, for rattlesnake envenomations and small animals, we always defer to the veterinarian. And so we don't manage those at all. Now, for a black widow, the one thing that you want to keep in mind is that for a cat, super serious, like they need to go into the vet right away. Cats are very, very sensitive to black widows, and they can die. So we want to get a cat with a black widow, just take them into the vet. Now in a dogs, in my experience, can tolerate a black widow bite a little bit better than a cat. So we may be comfortable watching that at home unless the dog develops symptoms, in which case that would be pain, and you would notice that, and then take them into the vet. But it's always kind of a judgment call on how the animal is doing at the time of the call. But once again, envenomations are, and these are black widows and rattlesnakes are kind of what we see in the Southwest, but there are other types of snakes throughout the rest of the country, and different spiders as well that could potentially cause issues that I'm not as familiar with. What do you think, Dr. Wismer?
So for most of the rattlesnake and other pit viper type envenomations, yeah, we do recommend seeing your veterinarian, right? These venoms can cause issues with the body's ability to clot, right? So they can bleed to death. We use antivenom in our patients, just like they do in people. Some of the same brands, some of the different brands. And with things like black widow spiders, You hit on the most important part, pain control. Okay. With cats, when cats are painful, their blood pressure skyrockets. And that's what causes most of the problems in cats. So definitely, if you can control the pain, they do well. And you know, cats, they hassle the spiders, right? They're poking at them under the cabinet, and so they get bit. Where I live, we have a different type of spider. We have brown recluse spiders, and those actually cause large non-healing wounds. So those are something you're going to see the effects, you know, days later, and we just have to manage the wounds. If you live in very southern US, we also have coral snakes, to go back to the snakes, and those cause neurologic problems, right? It causes the animal to become like paralyzed in the hind end. And as it moves forward, it affects the ability to breathe. So coral snakes can be quite deadly for our patients.
Thank you. And it looks like we're starting to run up on that 1 p.m. Mountain Time end session. And we do have one more question over chat before signing off. But from Debbie, are there any issues with things like automobile oil, antifreeze, gasoline, things like that that can really affect our pets?
Absolutely. Antifreeze, just like in humans, can also cause toxicity in animals as well. And so that is something that's another thing that we would recommend immediate medical evaluation or veterinary evaluation, as well as such as things like windshield wiper fluids, brake fluids. Those are also a concern. In humans, gasoline and motor oil usually are not as severe as long as they don't get down into the lungs. But I would love to hear what Dr. Wismer has to say about that.
Antifreeze is bad, right? If we're speaking of ethylene glycol type antifreeze, there is a non-toxic or less toxic antifreeze out there called propylene glycol, which it takes a lot more to cause problems. Dogs and cats really don't have problems with methanol, which is windshield washer fluid, except for the alcohol effects, right? It'll cause them to become, you know, drunk. We do worry about that, but they do not develop the seizures and the blindness that we can see in people because they're able to metabolize formate, which is what causes the problems in people. Oil, right? Inhaled into the lungs, same way with gasoline.
Awesome. So it looks like we've just about reached the end of our session here. I want to thank everyone for sending in their questions, and I want to thank our experts. I do want to pass off the mic to Dr. Wismer again, just to see if they have anything to add, anything we might have missed before we sign off here.
Let's see. Probably the most dangerous place in your house is grandma's purse. And if we think about what's in grandma's purse, if you're like my grandmother, there's sugar-free gum, there's over-the-counter pain medications, there's her heart medications, right? There's her Parkinson's medications. So literally, we have to train our family members to not put things on the ground, right? Don't put your purse there. Don't put your backpack there. Keep them out of the reach of pets.
Thank you so much. And for NMPDIC, anything else that you want to add to the session before we finish off here?
Yeah, you know, I would just want to reiterate that we do want to help animals at our poison center as much as we can with the animal poisonings. And just unfortunately, we just don't have the training, and we also just don't have the information a lot of times. But, you know, give us a call, and if we can help, we're happy to do so. If we aren't able to help, we'll definitely send you in the right direction. So definitely keep both numbers handy.
Awesome. Well, thank you so much, everyone. Really appreciate this. Very informative. Again, thank you for everyone who commented and provided questions for this. These will stay on Facebook and YouTube, so you can find them and share them for anyone who may have missed this but may wanted to see. I will include the hotline numbers for both poison control centers, and those will be in the descriptions for each video platform. Again, thank you everyone for being part of this. We really appreciate it, and I see here Debbie says, thank you everyone for all the great information. Thank you, everyone. I hope you have a great day.
Thank you.
Thank you, Tina.
It was fun.